My name is Dr. James Taylor. I'm a cardiothoracic surgeon. I work at LewisGale Medical Center in Salem, Virginia. LewisGale Medical Center, what I'm seeing is a cohesiveness and a really strong drive and desire of all the staff members. And everything has just really come together here as far as, I don't want to leave any specialty out, but as far as the OR crew, the intensive care unit, the step-down units, all the nursing staff that works there. The pharmacy has been working tirelessly, the case management. I mean, it's just, everybody works so well together and as a team, and they really care about how the program is, and more importantly, they care how the patients do. The team members just really work with the patients nonstop to really make sure they're doing okay. They go home and they call them at home to make sure and I've never seen that before, where they're actually working that hard, and the administration of the hospital. I mean, I can't say enough about how they have invested so much of their efforts into really putting a top-notch program together. Coming and working at places like New York City and Philadelphia, where I did a lot of my training, they're such big, busy centers that your letters are numbers. I mean, it's just really kind of that's typically what you see in a lot of the cities. But that's not what I'm seeing here at all. This is a really nice family environment, and they really care about the patients. And the patients are fantastic. It's a really great community, and the patients are great, and the staff has just been marvelous. And again, I can't stress enough on how it's really a team effort. You can start with the ambulance, the EMS crew. I mean, you start all the way back there. I mean, they need to get that patient to the emergency room. Then you talk about the emergency room crew. Then you have the cath lab and the cardiologists, and they do the angiogram. And then if they can't help them with balloon angioplasty, or if there's then they, of course, they call us for open heart surgery or bypass surgery. It's a whole chain of teams and events. So basically, when you get to the operating room, should you need cardiovascular surgery, you have your entire OR team. I mean, there's about 13 people in the room, so it's not a small deal. And so everyone really cares, and they really try to do their job, and they're fantastic. Typically, the patients, they're weaned off the respirator, and we can usually get the breathing tube out in a couple hours. They stay in the intensive care unit overnight. We can usually get them to the step-down unit the next day, and then of course physical therapy comes by, and they start working with the patient. We usually try to get the patients home in 4 or 5 days. It's a well-oiled machine that just really, it's working really well. The future goals in this program is to really just provide a very solid, dependable program that provides high quality to this community and patients. A lot of it has to do with the family atmosphere and the caring that they provide here that I haven't seen anywhere else. The nursing staff, and it's not just that they're family-oriented care, but they're very good. They're very intelligent, they're very sharp, they're well-educated, and they care. And so it's a very good continuity of care that you don't find in other places. My philosophy of patient care is really give the patient the care and personal attention that they need. I like to know the patients as well. Sometimes we'll talk about tractors or motorcycles or something, and I enjoy that. And so that's why, like in the Roanoke Valley in particular too, the patients here are just really, they're really family-oriented and very down to earth, and I like interacting with them and getting to know them.